All right. Good morning, everyone. Good morning, Prof. Good morning, Charles. Good morning, Paul Joel. Good morning, Hughes, if you can hear us, and good morning to everyone. Thank you for joining us for this very important discussion. As we all know, the world is facing a major health emergency. But there is another emergency that is developing on the sidelines of this pandemic, and that's one that is related to the quality of information that is available to citizens. As we all know, our citizens rely on information, particularly from the media, to be able to make decisions. And if that information is false or distorted, the decisions they make would also be problematic. This morning, we have a group of experts in different fields who would be discussing different dimensions of COVID-19 misinformation and also information and health generally during this morning. I'd like to quickly go around the table and ask each of our panelists to introduce themselves. But before we do that, let me outline a few ground rules that will enable us have a very fruitful conversation. The first thing that's going to happen is that once we begin, kindly turn off your microphones if you're not speaking, so that we do not have any background noise. To do that, just move your cursor towards the bottom of your screen. You're going to find a microphone icon. If it doesn't have a line across it, it means your microphone is open. Click on it to shut it. To open the microphone, do the same thing. We also have, you would notice, a platform for questions and answers separate from the comment section. Please use that if you have a question to ask. But if you have any reflections in the course of the discussion, please add that to the comment section, because you may not have time to take the floor and share your view. I'd like at this point for us to take a quick round of our panelists. Let's start with Professor Wilfred Mbacham. Prof, just say a few things about yourself.
Well, Eugene, thank you very much for inviting me to share the panel with the others. My name is Wilfred Mbacham, and I am a titular professor of public health biotechnology at the University of Yaoundé one in Cameroon. My work is in human and pathogen genomics, and amongst other things, I do coordinate the graduate school and also the program management committee at the International Atomic Energy Agency in Vienna. Thank you. Eugene, you need to unmute your own microphone.
Can we get Paul Joel now? Paul Joel?
Okay, so as most people are English speakers, I think I will try to speak also in English, even though I've prepared my presentation in French. So I'm Paul Joel Kamchan. I'm journalist, data journalist, and also fact checker. I'm the executive secretary of ADC, which is an NGO based in Douala, working on issues of access to information, freedom of speech, data journalism, and fact-checking. So I'm glad to share this panel with all other panelists. Thank you, Eugene.
Merci Paul. Tu auras la possibilité de dire quelques mots en français tout à l'heure quand on va commencer les discussions. Merci déjà d'être là. I'd like now to ask Charles. Hello, Charles. Charles is joining us very early from Washington, D.C.
Hi, good day, everybody. And Eugene, thank you for the opportunity to join your panel. I'm Charles Rice. I'm the CEO of Developing Radio Partners. We're an organization that works mostly in Africa on development projects. Right now, we have a project in Malawi on sexual reproductive health that has, in March, suddenly become a COVID-19 project. So we're working in that arena right now. We also we've worked in Cameroon, Rwanda, Cape Verde, and also in Somaliland.
Thanks indeed, Charles. We'll have the opportunity to hear a little more about your work very soon.
Eugene, your mic is on mute.
Sorry, I have been using the course of my laptop to mute and unmute myself, and sometimes I forget that I'm doing that. Thank you very much, Prof. We're going to have a very straightforward program this morning. First, we will have Professor Mbacham to give us some medical or health or background to the subject matter, and he's going to look at I suspect that at this point in the evolution of the pandemic, we have a fair understanding of what COVID-19 is. But the subject is still very technical for most of us, so Prof will be helping to ground the science for us. And then we'll turn on to Charles, who is going to be looking at media information and health, because and sharing experiences from the work that he has been doing in Africa, but also underlining why the role of the media is really, really important in promoting public health. Of course, we are having that conversation within the context of COVID-19. And then we'll turn to Paul, who would, based on this professional background, the public health background and the media background, Paul is going to discuss very briefly with us some key issues that are necessary in spotting and correcting misinformation about COVID-19. Once that is done, we will now have a conversation within the panel, and then we'll open up the discussion to the rest of the group. As I said, there is two possibilities for participants to participate. One is to use the question and answer facility on this online meeting platform. The other is also to use the chat facility. If you look around the dashboard of the platform in front of you, you'll be able to find a way. It's quite easy to find. Without much to say, let me, before I invite the first speaker, say a few things about the objectives of this discussion. What we really want to achieve by the end of the day is to be able to equip a good number of journalists across the country by providing them essential knowledge and giving them information on some tested tools to check misinformation so that they can produce massive impact with their reporting as journalists. We're going to continue working beyond the webinar, and we have plans to roll out a WhatsApp discussion group that will go way beyond this webinar and bring together participants and experts from different fields so that we can continue to sharpen our skills. With that said, ladies and gentlemen, please permit me to invite Professor Wilfred Bacham to say a few words. And Prof, if you will kindly start by telling us where we are with the pandemic.
Well, thank you very much, Eugene. I think even before I start, I think there are quite a few lessons that we are learning about this pandemic. The question is, did we have to reinvent the wheel from something that had occurred, 17 years ago? In 2002, there was this first atypical pneumonia, which was reported in the Guangdong province. And by March, the year after, in 2003, the WHO had actually issued a global alert for a severe form of pneumonia of unknown origin in persons in China, Vietnam, and Hong Kong. So that was like SARS-1. Later on, the CDC also issued out another health alert in March 2003. And subsequent to that was therefore all efforts to be able to contain that outbreak. It was contained 4 months later, that's by July 5th. And it was demonstrated at the time to have gone from bats through the civets, which are cat-like mammals, and therefore into humans. And when COVID-19 started, the question then was, why didn't they use the knowledge of the outbreak of 2003 to quickly contain what they were seeing as the COVID-19? And currently, I think that the number of cases or the case fatalities, that is those who have the disease and who have died, the percentage is now growing and happened in the first COVID, in the first coronavirus disease. So there was some amount of laxity, I think, on the part of the authorities. They could have applied all the measures that they later on applied before this virus actually got the spreading. Today, we have about 3.5 million individuals with about 250,000 deaths and just about 1.1 million that have fully recovered. The case for Cameroon, we've just gone across the 2,000 case number. We're at 2,086. And about 64 deaths and 953 that are recovered. Now, had we contained this epidemic within the confines of China, I think it would not have emerged into a pandemic. Now, what's an epidemic? It's an outbreak of disease that spreads quickly and affects many individuals at the same time. And a pandemic is an epidemic that has taken a much wider audience and covers a wider geographic area and affects exceptionally high proportions of the population. Now, if you look at what we now know, thanks to the science that's also evolving behind the coronavirus, we now know a number of things that are possible to explain why the disease is spreading and how it spreads. Essentially, it spreads by contact, and therefore it's a contagion. And this is from droplets that either leave your mouth or leave when you sneeze, or when you cough. And so basically, by reason of these droplets landing on surfaces, then people are able to take these and be able to give the next person and the next person. And before you realize, exponentially, everyone is getting the virus. Now it spreads because apparently the virus takes hijacks the cell within the lung space and is able to multiply within that space. Because of that multiplication, it causes a lot of cellular debris, which cellular debris triggers what is called an overload of the immune system, an over-response of the immune system, which is called a cytokine storm, because these are like innate responders, and they now attack. This cytokine storm now is shared into the body, and the body, in trying to respond to that, develops some kind of a pneumonia, and that's the pneumonia that is causing a lot of deaths. The other thing we know also is that there is a lot of blood clotting in the very small blood vessels, and when that happens, then it excludes blood to various parts of the body, and by reason of that exclusion, normally when your body is not reoxygenated, there's a likelihood that you will die. Now, what has also emerged as a possible hypothesis for its spread is the fact that these cytokine storm that we see, in addition to this immune overreaction, there's a hypothesis that it is not only due to the virus, but that in essence, the virus associates with a bacterium called Previtola, which is found in the oral, intestinal, and vaginal cavities. Previtola happens to take in the virus, so the virus is now acting as an infectious agent of the bacterium, and by reason of it infecting the bacterium, is causing the bacterium to multiply. And the hypothesis is that this multiplication of the bacterium beyond what it should be in the normal flora is what is triggering all these immune responses and causing all of that. So our microbiome is also very important in exactly how this is spreading. Now, there's been also a hypothesis about radiation causing it. Well, radiation may cause cellular debris, and this cellular debris might trigger the cytokine storm, in the sense that it triggers unusually this high response of the human body to the presence of this cellular debris. But we still need to go back to the lab and be able to show exactly that this is particularly the case. Otherwise, when you hear about viral infection, the first thing that comes to your mind is that 80% of us are capable of containing the virus. However, there are some 20% that go beyond the tipping point, and they become complicated and they become very severe, and of which then a certain percentage would therefore die. And so basically, if we can do anything to stop the progression of the disease beyond the tipping point, then it will be very, very helpful. And of course, we still need to practice all the preventive measures of wearing a mask, and that's a physical barrier. It will limit the extent to which droplets actually are distributed. And if the other person is wearing another mask, it will also limit the extent to which these droplets can be taken in. We need to wash our hands frequently. We need to distance ourselves from individuals. We need also to hand sanitize as frequently as possible. And if at all we do feel sick, then we shouldn't go out. We should think of the neighbor, we should think of our other people whom we do not want to infect, and therefore intentionally impose on ourselves a certain amount of confinement and restriction or quarantining, so that we take care of the health of our brothers, of the other people. And so we have this collective responsibility to act wisely, but also to act in a manner that shows that we're responsible. And it's not just our health that matters, it is our health that matters in general, and not personal health that matters. I think I would stop at this point, and if there are any questions, I will take them much later on in the course of the discussion.
Thanks indeed, Prof, for that background. And if you can, talking about questions, if you check the Q&A section of the platform from time to time, and there are any questions you would want to answer there directly, that would save us a lot of time, and everyone else can be able to view the answers. Now, a key to our response to COVID-19 is information. The public relies on what they hear from the experts like you, but also what is conveyed by the media to be able to make decisions. Let me turn to Charles to talk to us about the work that he does, but also to try to make the connection between right information and adequate public response to health issues. Charles, again, thank you for joining us. I know we got you up quite early to be part of this discussion.
Oh, it's a pleasure to be here. And I just want to say, Professor, your description just now is exactly what journalists need, I believe. Easy to understand, not getting too complex, because if the journalists don't understand the information, it's very difficult for them to explain it to their listeners or their subscribers or viewers. We work in radio, and right now we have a project, as I mentioned, in Malawi, working with about a dozen community-based radio stations. And the reason for that, and I think COVID-19 has really underscored the importance of radio, because something like 80% of the population listens to radio, and it's because it's inexpensive. A lot of people have it. A lot of people don't have television, but they do have radio. Electricity in Malawi is somewhat of a challenge at times, so people have batteries or a solar-powered radio. So it's a really excellent way to convey information, and it's also a great medium for physical distancing. So that's why we work in radio, because of all those reasons. And I think COVID-19 has really, radio is a great way to convey information about COVID-19. In Malawi, and I think I can share this on the screen. In Malawi, and I want to thank Eugene for designing this template. Can everyone see what's on the screen there? Every Monday morning, and this is one that we produced for last week, with our partner radio stations, they get a copy of this, and it is based on information from a variety of sources, Johns Hopkins, CDCs in Malawi, in the United States, as well as the Ministry of Health in Malawi. It also comes from various districts across Malawi. This one was focused, as you can see, on stigmatization, and that is something that has been happening around the world, here in the United States, for lots of different reasons, but also among healthcare workers. People are being stigmatized because they are working with people who might have COVID-19. And our bulletins began in early March because we realized how dangerous this was going to be to the entire world, but particularly across Africa, because of not having the medical personnel to care for everyone, and facilities and so forth. So what we did was we created this bulletin in order to share basic information in the early stages, but eventually covering stories like stigmatization and other issues. For instance, this week I'm working on the bulletin on the importance of covering your face and using gloves and masks on a regular basis. And this is something that we have been encouraging our radio partners to do as well. We have about 150 reporters that we're working with across Malawi, and they're putting their health and lives on the line by going out and covering stories. And we want to make sure that they observe physical distancing, that they are using wiping down their workspaces on a regular basis, multiple times per day. But we're also conveying this information to their listeners as well. And it's just really, really important that people don't go to the clinic, for instance, to get help until they make the phone call. And you can see here, there is a number. And we produce this every week because people have a habit of just, if they're sick, they go to the clinic or try to get to the clinic. And that is something that should not be done, as the professor pointed out in his presentation. But that is what we're doing. And this information is changing constantly. And at the national level, there may be information coming out in Malawi that may be different, and in the United States, it may be different from the district or local level. And what we try to do is make sure anything that is put out is accurate. That is very, very important, because sometimes I know, Eugene, you were telling me that there were lots of myths and misconceptions out there that holy water could make you immune to the virus. Sunlight, for instance, is another myth, that sunlight can protect you, that young people are safe from the virus. And here in the United States, there's many, many different myths and misconceptions, sometimes coming from the highest levels of our government. So there's all kinds of issues. And what we do in radio is try to take this information and put out only what is accurate. And this bulletin is an effort to achieve that each and every week. Something else that we encourage the radio staff to do is to make daily contact with their district health officer. That's really, really important, because information can change by the hour. And they need to check in on a daily basis, sometimes several times a day. We have this bulletin is prepared by one of our trainers on the ground in Malawi. It's written in Malawi and researched in Malawi, and then it goes through a second trainer. Then it comes to me. Then it goes back to the person who wrote it, and they make final edits. And then every Monday morning, it is sent out to our partner radio stations, hopefully with no mistakes. You can see here, we even include a short script for a public service announcement. And something that's happening on a daily basis is at least 10 public service announcements are broadcast. Oftentimes they're little jingles or radio dramas, very short, maybe a minute long, and the objective there is to make sure that people remember things. It may be a jingle that wash your hands, or cover your cough, cover your sneeze, and it will cause behavior change, because when people hear the jingle, they remember it, and it gets in your head, and it will cause people to change their behavior. So we include a script for a PSA that the radio people can produce. Another thing that we have done is produced a public service announcement with an elderly grandmother who is concerned that her younger grandchildren are going out and not observing physical distancing, and she was fearful that she would catch the coronavirus. So different things like that, trying to appeal to people on a very personal level to change behavior, and changing behavior very quickly, because this virus is so deadly. I'll stop there and just open it up to anybody has any questions at this point. Eugene, we can't hear you. I do it all the time.
Thank you very much, Charles. If you would bear with us, just hold on for a minute and we'll have people ask questions. Again, you can use the QA button to ask questions. Prof, there's already a question there for you. If you can take a look at it and you can provide a response directly. Where it's possible, we'll have the responses during the live discussions. You point out there, Charles, a number of interesting things. The reason we really wanted to have you here is because your work has a lot of lessons about what is possible, what the media can do and what journalists can do, and the different approaches that they can use to put out accurate information. But also, as you point out, there is also a lot of misinformation. And the reason we think that fact-checking as an approach is also very useful is that fact-checking doesn't only focus on providing accurate information, but also in calling out wrong information, in pointing out to people that this information that might be coming out at this point is inaccurate. And there is quite, from a very conceptual point of view, an interesting relationship between fake news as far as COVID-19 is concerned and public behavior. What we have seen so far, as you rightly pointed out, is that we have a lot of misinformation in terms of false claims. For example, false claims about remedy. But there's some very interesting conspiracy theories as well that do two interesting things in my view, that they cast doubt on the public. In Cameroon, for example, people are still raising questions about whether or not COVID-19 is real in spite of the media reporting. And this is really because of the doubts that have been raised in their minds because of conspiracy theories. Those who say that, for example, that governments are jacking up the number of cases to be able to receive foreign aid. The number of people who are dying is not true and stuff like that. But more interestingly, it's directing public debate in the wrong direction. People are having the wrong conversation at this point. In Cameroon, for example, in the last couple of weeks, information about not the government's handling of the crisis, but a WHO gift to the government of Cameroon has become the center of the public debate. And the discussion has moved away from how do we stay safe under these conditions and begin to question why would WHO provide government with 4x4 vehicles when the country needs ambulances. So it is very critical that misinformation is also tackled. And Paul Joel does quite that work. He's been working with the key partners of this initiative, Defy Hate Cameroon, to develop some capacities in fact-checking. And he also runs a fact-checking website, his organization, I mean. And Joel, I'd like to invite you, before we open the conversation to the rest of the group, to tell us a bit and focus really on the kinds of tools and skills and approaches that on a practical level a journalist can get out and be able to spot. And I'm very keen about being able to detect false information and how they can go about correcting it. Before you come to the participants, it would be interesting to participate as well by thinking about some forms of COVID-19 misinformation that you have encountered, and just type that in the comment and the chat sections of this discussion or in the Q&A section. Just anything in your experience with COVID-19 misinformation and some experiences you have in dealing with COVID-19 misinformation and fact-checking it at a personal level, so that we can all share from the inputs of everyone. Paul Joel, I'll give the floor to you to speak to us for about 10 minutes.
Okay, thank you, Eugene. So please, I hope that you will allow me to speak in French because I prepare my presentation in French. And I remark that in our group, some people cannot catch up what we have spoken here. So I will try to speak both even in English and also in French.
That is fine. I'm sure Charles can follow to some extent.
Okay, okay. So let me share my screen. I don't know. Yes, okay. Okay, so please, can you allow me to share? Yes, okay. Okay. Okay, so bonjour à tout le monde, notamment ceux qui ne sont pas sur le panel et qui nous suivent certainement. Je voudrais juste indiquer que j'ai fait une petite présentation. On va revenir un peu sur la notion de fact-checking, l'approche notionnelle que tout le monde connaît déjà, qui se résume essentiellement aux définitions, au contexte et à quelques approches techniques. Donc, on parlera également de la législation en matière d'accès du public à l'information appliquée à la santé. Parce qu'en réalité, en parlant de la COVID-2019, ce qu'on oublie, c'est qu'on est dans un domaine très sensible où en réalité, il prévaut le secret médical et la vie privée. Et donc, quelle est l'attitude du journaliste ou du fact-checker face notamment à ce challenge? Il faudrait bien sûr dire que c'est un challenge parce qu'en réalité, vous vous souvenez, on parlait de Kavaïégué, le président de l'Assemblée nationale, est positif, mais personne n'a pu obtenir justement un test qui prouvait effectivement qu'il était positif. Et en réalité, tout ça relève du secret médical et de ce qu'on appelle la vie privée. Parce qu'il faut dire qu'en matière d'accès du public à l'information, il y a quand même trois informations ou alors trois catégories d'informations qui ne devraient pas tomber dans le public, à savoir les informations liées au secret médical, les informations liées au brevet d'invention, les informations classées secret défense. Vous vous rappelez qu'à chaque fois, lorsqu'on traite de tout ce qui concerne l'armée, c'est toujours avec beaucoup de réactions qu'on a des retours. Et puis, on parlera aussi où trouver les informations et sources fiables dans le cadre de la COVID-2019. J'ai répertorié quelques sites dans le monde qui vous permettent d'avoir accès à la fois aux données et même aux informations en temps réel qui sont régulièrement mises à jour, contrairement par exemple à d'autres sites où c'est après 48 heures, c'est après 72 heures. Et donc, je vais vous faire un petit listing. Et à chaque fois que vous allez y aller, vous pourrez avoir une information aussi bien au niveau mondial, au niveau africain, au niveau sous-régional, au niveau du Cameroun, qui peut vous permettre ces données de faire des comparaisons aussi bien du Cameroun, de l'Afrique centrale, l'Afrique de l'Ouest, ainsi de suite. On va revenir parce qu'il faut préciser que les Nations Unies, à travers ces agences, ont mis une batterie de mesures pour essayer de juguler le phénomène. Il y a même des données qui existent qui permettent de prévenir, de juguler les enjeux économiques. Et on parlera également de quelques sources au niveau local, c'est-à-dire au niveau local où trouver certaines informations, comment avoir accès et consorts. On parlera de quelques outils numériques de vérification des faits les plus usités en ce moment, qui ont été développés par plusieurs organismes qui travaillent et qui font beaucoup de recherches sur le fact-checking. Alors, pour revenir à l'approche notionnelle, je ne voudrais pas revenir dessus parce que tout le monde sait ce que c'est que le fact-checking en anglais, qui signifie simplement en français la vérification des faits. On parle généralement de plus en plus au-delà des outils conventionnels ou alors des outils numériques. On parle parfois des méthodes classiques de détection de fausses nouvelles, c'est-à-dire le contenu. Il faudrait vous assurer déjà le contenu, comment ce contenu est bâti, comment il est structuré. Est-ce qu'à partir de ce contenu-là, vous pouvez facilement détecter que c'est un faux? Je vous prends l'exemple, par exemple, excusez-moi cette répétition, de la note qui fait jaser depuis hier sur les réseaux sociaux, où il y a tout un bon de commandes administratives qui a été signé par le secrétaire d'État à la santé en charge des grandes endémiques. Dans ce bon de commande, en réalité, on a pu discuter avec des inspecteurs d'impôts, avec des fiscalistes qui ont relevé plusieurs incongruités dans cette note. Par exemple, en faisant remarquer qu'il y a une nette différence entre le coût hors taxe et le TTC, tout taxe compris, parce qu'ils s'étonnaient de ce que, comment le tout taxe compris peut être supérieur à un hors taxe. Les données, par exemple, qui sont contenues dans ce bon de commande nous ont permis de savoir que cette entreprise-là a été créée en février 2020 et qu'en réalité, il y a eu une note bien avant, par exemple, du secrétaire général de la présidence de la République qui indiquait une dérogation spéciale au ministre de la Santé qui doit passer certains marchés dits spéciaux. Donc, il y a par exemple là, il faut déjà voir les archivistes ou alors les experts du contenu du document appellent tout cela les aspects calligraphiques d'un document qui vous permet de savoir si un document est conforme et à partir de ce document, vous pouvez dire si c'est un fait ou pas. Il y a la source également, comme on l'a toujours martelé plusieurs fois dans nos différentes rencontres, d'où provient le document, quel site l'a publié, quel journal l'a publié, est-ce que ce journal est fiable, ainsi de suite. Il y a par exemple le support également. Est-ce que c'est un support agrégateur, c'est-à-dire qui a seulement repris, ou c'est un support qui a produit ce contenu, ou alors qu'il a analysé? Est-ce que les éléments d'analyse sont des éléments pertinents, convaincants, et ainsi de suite? Il y a le niveau de viralité. Le document dont je parlais il y a encore quelques secondes fait un tollé général sur les réseaux sociaux. C'est tellement partagé et c'est en train même de tomber dans une sorte de conflit politique où désormais on a des partis politiques qui accusent les autres d'avoir été à l'origine de cela parce qu'en réalité le ministre aurait refusé de recevoir un don d'une certaine organisation politique. Donc il y a tous ces éléments en réalité qu'il faut mettre ensemble pour analyser et comprendre en réalité quels sont les enjeux derrière. Et la viralité, comme je le disais, fait partie des éléments clés qui permettent de contextualiser la fausse nouvelle, les fake news, comme on le dit souvent. Il y a également la récurrence de l'information par d'autres supports. Parfois, c'est partagé exprès dans des grands groupes. Vous avez des groupes comme le Cameroun, c'est le Cameroun qui compte plus de 200 000 membres qui permettent justement d'avoir une idée du niveau de viralité. Donc, au-delà des réseaux sociaux, comme on le disait, il est aussi question de voir si cela est repris. Alors, quels sont les commentaires qui gravitent autour de cela? Donc là, ce sont des approches vraiment naturelles pour essayer de détecter les fausses nouvelles avant maintenant d'entamer l'approche beaucoup plus avancée. Alors, la deuxième partie permet de parler justement de la législation en matière d'accès du public à l'information appliquée à la santé. Il ne faudrait pas que les fact-checkers ou alors les journalistes perdent de vue qu'on est dans un domaine bien précis qui est celui de la santé, qui fait en réalité appel aux questions et aux notions de vie publique, aux notions de secret médical. Parce que si vous fact-checkez et que vous finissez par rendre, par exemple, un bulletin médical de quelqu'un public, alors écoutez, vous allez courir le risque de vous faire poursuivre par les juridictions parce qu'en réalité, cela a été partagé parfois avec ou sans l'aval du propriétaire. Donc, il faut toujours faire très, très attention lorsqu'on traite des informations liées, par exemple, aux questions de santé. Vous vous rappelez, ça faisait beaucoup jaser. On parlait, par exemple, du président de l'Assemblée nationale qui était dans le vol du 14 juin, vous vous rappelez, du 14 mars, autant pour moi, le vol de tous les enjeux et de tous les problèmes auxquels nous sommes confrontés en ce moment. Et donc, il y a eu un certain nombre de choses. Vous vous rappelez qu'il y a plutôt certains qui ont pris sur eux de dire qu'ils sont en quarantaine parce qu'ils soupçonnaient. Et je vais dire que jusque-là, ce n'est pas assez suffisant parce qu'il n'y a pas une preuve. Ben, on dira que c'est la source primaire et donc elle peut dire qu'elle est atteinte ou pas. On l'a vu par exemple avec le Premier ministre britannique où il y a eu tout un communiqué dessus qui essayait d'informer les Britanniques au fur et à mesure sur son état de santé. Par contre, au Cameroun, c'est resté toujours un mystère. Et donc, ça pose en réalité le sérieux problème de personnalité publique, vie privée. Est-ce que quand on est une personnalité publique de la trempe du président de l'Assemblée nationale, par exemple, on devrait avoir sa vie privée dehors, avoir par exemple des informations sur sa santé. On parle par exemple de la santé du président de la République, qui est une histoire taboue. Pourtant, ailleurs, on parle du... Vous vous rappelez, par exemple, quand le président Boari doit aller faire son check-up en Angleterre ou en Inde, la présidence de la République prend la peine de faire tout un communiqué là-dessus. Malheureusement, c'est une question de législation parce qu'en réalité, la question du Freedom of Information Act, comme on l'appelle souvent, qui est une loi sur les questions d'accès à l'information, n'est pas encore prépondérant au Cameroun. Et donc, du coup, le producteur ou alors celui qui est chargé de mettre l'information à la disposition du public se réserve encore tous les droits de recel sur cette information parce que en réalité, la mise à la disposition du public n'est pas encadrée. Et par contre, ailleurs, c'est encadré parce que savoir l'état de santé du président de la République, par exemple, dans d'autres pays, cela relève en réalité de ce qu'on appelle l'open government, donc le gouvernement ouvert, qui permet justement de communiquer régulièrement sur la situation des différentes personnalités qui gèrent le pouvoir ou alors une portion de ce pouvoir. Et donc, pour le cas du Cameroun en matière de législation, il faudrait beaucoup faire attention parce qu'en matière d'accès du public à l'information, on aime toujours surfer sur les textes au niveau régional, notamment l'article 9 de la Déclaration universelle des droits de l'homme, parce qu'en réalité, il n'existe pas un texte ou alors une loi cadre sur les questions d'accès à l'information au Cameroun. Alors, c'est où je disais, il faut faire beaucoup attention lorsqu'on traite des informations liées au Covid. On doit beaucoup faire attention à la vie privée, au secret médical et consorts. Alors, revenons donc à la troisième partie où trouver les informations et les sources fiables dans le cadre du Covid. J'ai fait un petit répertoire qui n'est pas exhaustif parce qu'il en existe beaucoup. Beaucoup d'organisations internationales de plus en plus se mettent ensemble pour produire un certain nombre d'outils pour aider à la fois la société civile, les journalistes et même les gouvernements pour mettre des données à leur disposition pour essayer de leur faire prendre conscience et de faire très attention au rythme de cette maladie. Et vous savez que quand on parle du Covid, on parle beaucoup plus de données. Et on est là dans le cadre de l'open data, qui en réalité est une donnée dont le fact-checker a besoin pour justement faire son travail. Donc là, je vous présente par exemple les données sur l'évolution de la maladie dans le monde au jour le jour, qui est COVID-19, qui vient de l'Organisation mondiale de la santé. Vous avez une autre longue liste d'organismes dans le monde travaillant autour de la COVID-19 avec des informations consultables et les plus mises à jour. Ici, par exemple, vous avez des informations qui sont mises à jour par le Programme alimentaire mondial pour retracer au jour le jour les influences de la maladie sur les insuffisances alimentaires ou alors sur la suffisance alimentaire. Il y a des projections qui vont jusqu'à 2 mois, qui vont jusqu'à 3 mois, qui vont jusqu'à 6 mois. Dans le cas du Cameroun, par exemple, le gouvernement vient de commander une étude à l'Institut national de la statistique pour essayer de faire une étude analytique et comparative de l'impact du Covid dans le secteur économique. Parce qu'en réalité, pour le gouvernement, c'est les résultats de l'INS qui vont permettre au gouvernement d'adresser la deuxième étape ou alors la deuxième partie du canevas de riposte du gouvernement, en même temps que ça va lui permettre de voir comment juguler le phénomène, notamment dans le domaine économique. Donc, les États s'organisent, les organisations internationales s'organisent. C'est également le cas du Global Investigative Journalism Network, par exemple. Vous allez voir qu'ils essayent de mettre à la disposition des journalistes des informations dans le monde. Vous serez surpris de voir, par exemple, des informations sur le Cameroun, également dans tous ces liens-là, les informations les plus actuelles d'ailleurs et des données également. Et puis là, je vous suggère quelques conseils de grands journalistes sur comment aborder le traitement de l'actualité liée à la COVID-19. Ici, on a essayé de faire une sorte de répertoire de grands reporters dans le monde, des grands journalistes, des grands médias qui essaient de partager leurs expériences pour le cas du traitement de l'information lors du fact-checking en période de crise, parce qu'il faut dire qu'il faut faire une différence entre le fact-checking en période de crise et en période normale, parce que les sensibilités ne sont plus les mêmes, les sources ne sont plus forcément accessibles de la même façon. Il y a toujours un certain nombre de contrôles d'informations pour justement permettre au gouvernement ou alors aux parties prenantes de voir comment juguler le phénomène. Alors, je vous propose quelques sources au niveau local. Vous avez l'étude du ministre de la Santé. Vous voyez, ces études sont de plus en plus partagées et ça donne une idée de l'évolution de la maladie, en même temps que ça donne une évolution des politiques publiques en matière, par exemple, de résorption de cette crise du Covid, avec tout ce qu'il y a autour comme discussion, comme débat et les prolongements qui s'en suivent dans les médias classiques et même les médias les médias actuels. Alors, ce qu'il faut rappeler, c'est que déjà à Yaoundé, il existe un centre Covid 2019 qui fait le point tous les soirs. Vous voyez parfois à STV, à Equinox, à la CIA TV, des journalistes se rapprocher pour avoir le point de la journée. C'est important pour les journalistes et pour les fact-checkers d'avoir des contacts là-bas parce que ça pourra les permettre de vérifier l'information en temps réel. Parce que vous le remarquez autant que moi dans les réseaux sociaux, ça va très vite, ça va vraiment à la vitesse. Je vous rassure que d'ici 18 heures, il y aura encore une autre fausse nouvelle qui va défrayer la chronique. Donc, le fact-checker ici devrait se comporter un peu comme un militaire. Il faut toujours être à l'avant-garde, il faut se cultiver. Alors, Eugène, juste pour finir.
Oui, les outils.
Oui.
Dis quelques mots sur les outils et on
Oui.
peut... Oui.
D'accord. Alors, revenons donc sur les outils numériques de vérification des faits. N'oubliez pas les recherches par mots-clés. Il faut affiner la recherche en partant, en allant à google.cm pour être convaincu qu'on a une bonne couverture sur le Cameroun lorsqu'il s'agit d'une information qu'on veut vérifier. Il y a InVid, par exemple, pour les vidéos. Il y a Yandex également pour les photos. Il y a Web Archives qui vous permet justement d'avoir. Il y a une pléthore d'outils mis à jour régulièrement. Il y a Tinai, il y a plusieurs outils qui vous permettent justement de travailler. Mais à côté de ces outils, il ne faut toujours pas oublier la recherche, la vérification des faits naturels qui consiste à confronter les sources, à vérifier l'information et affiner ces différentes informations auprès des différents démembrements au niveau du département, de l'arrondissement, de la commune et même des journaux crédibles. Voilà, Eugène. Merci beaucoup.
Thank you very much, Paul. I think your presentation touched on some of the key issues that we were hoping to see during this discussion. And I want to ask you to update your list and share with us so that we can share with the participants soon after this, especially the resources that you have provided for us. Now, there is, not to repeat you, can you take down your screen so that I show something, Paul? There is something you said, and again, I want to, because it's important that we also are aware of the risks that are involved. And this idea that misinformation can cast doubt and direct public debate in the wrong direction. And you've done very well with the example of the discussion about the purchase of medical supplies by the Ministry of Health, which for a while became the main story for an entire day when the real information about COVID-19 is not being covered. And people are beginning to think that all of this is some economic manipulation. People want to sell supplies, people want to sell vaccines and stuff and so on. Thank you very much for that brilliant presentation. I'm going to open the conversation to the public, and I want to do it this way. I want to quickly take some of the questions that are in our Q&A section have been answered, but I'd like to ask, by show of hand, there is a hand-raising possibility on the platform, and I'll take someone from the floor to either make a comment or ask a question to the panel. But remember that the chat and Q&A tools are also very useful because they allow everyone to be able to say something. And while you're figuring out how to use the platform, let me ask a question that has come up over and over in the discussions. Traditional medicine, Prof. Traditional medicine has been a very difficult subject for journalists, especially in the context of misinformation. But there is more to it than a simple wrong and right, isn't it? Prof.
Well, yes, I think you you've just underscored essentially. First, I think there are quite a number of spices and a number of herbs around us that help alleviate pain and suffering when we are infected with and feel a certain comfort before we go to bed or when we wake up to invigorate our body. So essentially these substances that are found in herbs help boost the immune system. They help us fight disease. Now the body normally would fight disease control. Now the body fights disease. And what you actually diagnose at the end of the day as the presence of a parasite or a virus is residual of what is happening with viral replication, the multiplication of the pathogen, and what the body actually eliminates. And so what you get is usually the residual. Now, having said that, some of these plants may have antiparasitic, antiviral, antibiotic, but most of them have anti-inflammatory, anti-oxidants, and this is what helps the body to wage a better and stronger immunity. Now, sometimes when these plants are brought together, they're brought together to be able to address the symptoms until we can show the active ingredient and show the mechanism by which it acts or acts against these pathogens. Usually scientists tend to be a little bit reserved in prescribing it as therapy. But what they say, it is alternative medicine, and people can take it to boost their system without necessarily ascribing an antiviral or antibiotic or antiparasitic property to these medicinal plants. But if it does, so well, the better. So once this is done, the caution that scientists often say is that we're trying to do good by bringing these mixtures together in alternative medicine, but we should not at the same time cause harm. So it's a balance between beneficence and non-maleficence. So in trying to do good, do not cause harm. And these are basic tenets of bioethics. And so scientists are aware of that. The second issue is that we cannot tell exactly the dosing and when these are given. So do you need 2 sachets, or do you need a handful to have the same condition, or do you need 2 handsful to have the same effect? We can't tell. So basically, that dosing has to be done. That's pharmacology. The other aspect is that under what conditions can you give this? Should a pregnant woman take it? Because some of these medicinal plants are also abortifacients, so they can cause abortions. In other conditions of, say, diabetes or hypertension, you don't want to give a medicinal plant that raises your blood pressure. So you have to know the different conditions under which these are acting. These are usually the precautions scientists want to take. But if something that is consumed, people will take it. It's not everybody in my house that desires to take a particular tea. Some take some teas and it itches. I take and I feel comfortable. So which are the different populations that respond to this? This is what we need to follow up, for example, the things that Madagascar put out or the things that the Archbishop Cleda put out, and quickly resolve it so that it can be generalized. Most of our most potent medications have come from medicinal plants. We don't deny that fact. But I think that we need to be cautious that we do not cause harm in trying to do good.
Thanks very much. I think the point you underline there is that these issues require a little more reflection, a more profound discussion than what we have seen so far on the media. Abon Blaise, I saw a hand from Abon, participant Abon Blaise. Can you turn on your mic and ask your question to any of our panelists?
Hello. Can you get me?
Go ahead, Blaise.
Okay, fine. Now, I just wanted to, I'll ask the question, and I think between Joel and Charles, anybody could throw in some information. There's this understanding that information about COVID is increasingly becoming a matter of sovereignty. So states want to control the amount of information that the public is getting about a number of confirmed cases, a number of deaths, a number of recovered persons. It's especially the case with China. Today, there is this profound and deepening accusation that the number of persons reported dead in China are not actually the real number. So in the face of, from an information point of view, it becomes some kind of a talk of war when the journalist has to, prove that there are actually more persons infected or more persons are dying of COVID than the state will want to acknowledge. And you can understand that this can definitely become a situation where there is this, there is this battle. So what position is the journalist supposed to take? If for the sake of, what should I say, public order or public peace, is it normal for journalists to sit and stick to the figures that are coming from state officials, or what increased work can be done to make sure that you can adequately inform the public? Thank you. Thank you.
Thank you, Blaise. Charles, let's start with you.
Thank you, Blaise, for that question. Yeah, last week we had a situation here in the United States where certain counties in the state of Florida decided not to share information about deaths and the number of people who have been exposed who are testing positive. It's a serious problem, and it occurs around the world. You mentioned China, and I think what the journalist has to do is try to root out as much information as they can. There is a website that we use, and I know this information often comes from states or countries, and I'm trying to share this on the screen if I can bring it up real quickly. This website is sort of like the Johns Hopkins site, but again, this information is probably coming from states. So if the state is not sharing accurate information, then the information here may not be as accurate as it could be. But I think you have to check multiple sources. I know in Malawi, for instance, I mentioned earlier that something that you hear at the national level may sound conflicting to what you hear at the district level, and something you hear at the local level may be different than what you're hearing at both those other levels. So as a journalist, I think you have to check as many sources as possible that are reputable, and use those to try to root out the correct information. I know that's what's being done in the state of Florida when certain counties are refusing to release information.
Paul?
Yes, I want to start by the end of the question of Charles asking what should be the position of the journalists in this battle. I would like to say that journalists don't have to take any position. The position is fact. What are facts in these issues? That can be only be the base of the work of the journalists. You don't have to take any position in this battle, because you know, in matter of wealth in the world, COVID showed that there are many struggles between different stakeholders in this struggle. So I think as journalists, as fact checker, you just also have to show the fact and to show to your public how you have proceeded to build your information so that they can be able to better understand the process of your article. So I think that the only position you can have here is only fact and only fact.
Thank you very much, and I cannot agree more with that. The journalist has never been in a position. You remember during our last training, I was pointing out that one of the most suspicious sources to me are official sources, and it's because of things like this. And so the journalist should learn to go beyond the official source and treat the official source with a lot of suspicion. It's helpful in the pursuit of fact and truth. We're going to shortly veer the conversation towards what we can do. And I'm still encouraging, I see a lot of people are using the tools that are available for us to provide this information. What can we do as a community of journalists and experts to improve our coverage of COVID-19, but more particularly combating misinformation about COVID-19? So if you can move the conversation in that direction, that would be helpful as well. But while we are doing that, I'm going to take one more question from the chat forum, which I think may be useful for discussion in the group. It's about the role of social media operators, and I think Joel, you probably would have you've done some work with Facebook. What can we do? Not only in what do social media owners like Facebook and Twitter and the rest do to combat fake news, but what can we do as a community to hold them accountable? I think it's a summary of many questions on that subject that have come up in the discussion area. Let's start with you, Joel.
Oui, alors ce que je voudrais déjà dire, c'est Facebook est en train de développer deux grands outils qui seront bientôt mis à la disposition de ce qu'ils appellent les partenaires de confiance. On a cette chance d'être un de leurs partenaires de confiance au Cameroun. Pour le moment, ces outils vont permettre justement aux fact-checkers et aux journalistes de pouvoir retrouver une fausse information qui avait déjà été mise sur la plateforme de Facebook. Ce qui fait que si l'information existe dans la base de données de Facebook, à l'aide de cet outil, vous pouvez retrouver, ça peut être le son, ça peut être l'image animée, ce qu'on appelle prosaïquement la vidéo, ça peut être des textes, ça peut être des photos et consorts. Donc, aux dernières nouvelles, les techniciens sont en train de travailler et ça ne pourrait être prêt que vers la fin de 2021. Pour le moment, ce que Facebook essaye de faire, c'est de trouver des partenaires de confiance qui signalent des contenus et auxquels il leur donne accès directement aux techniciens qui sont basés à la Silicon Valley aux États-Unis. Lorsque vous signalez et que ça obéit aux standards de la communauté, tout de suite le contenu est retiré de la plateforme ou alors on vous explique que en fait cette information ne viole pas les standards de la communauté. C'est pour ça qu'en réalité le gros débat qu'on a eu récemment à Nairobi, c'était de voir comment au-delà de supprimer ces contenus, on doit continuer à respecter la liberté d'expression de ceux qui vont sur Facebook. Parce qu'il y a eu un sérieux débat entre, oui, on enlève les contenus, mais on fait comment du respect de la liberté d'expression. Et donc, ça continue, ça a permis d'avoir ce qu'on appelle une sorte de conseil de contenu dans le monde qui sera représentatif des experts. Ce sera des sociologues, des journalistes, des consorts qui, avant de retirer un contenu sur la plateforme, vont s'asseoir pour analyser, pour aller au-delà de la violation du standard de la communauté, pour voir si en retirant, on respecte toujours la question de la liberté d'expression parce qu'il ne faudra pas perdre de vue que Facebook a été créé pour 3 grandes missions, dont la liberté d'expression, l'accès à l'information et puis le droit de se réunir, la liberté d'association. Donc, ce qu'on peut faire en tant que communauté, c'est de voir comment avoir un rapport direct avec Facebook qui nous permet de dire à Facebook à chaque fois qu'il y a une mauvaise information sur la plateforme et qu'au-delà, par exemple, du standard de la communauté, on peut argumenter pour leur dire en quoi est-ce que cette fausse nouvelle peut être nuisible aux questions d'équilibre sociaux ou alors de nos différentes libertés. Donc, je crois qu'on peut se constituer dans le cadre de la communauté et engager des discussions avec Facebook qui permet à la fois de lutter contre les fausses nouvelles et même contre les discours haineux en ligne, parce qu'on l'a fait dans le cadre de Fact Matter.
Thank you very much, Paul Joel, for responding to that question. One of the questions that I'm seeing here, and before I pose it, is to say that this is exactly the conversation we're trying to have here as we close. That is, how can we, as a community of journalists, media experts, and public health experts, work together to combat misinformation. One of the things that is already being done, I'm sure that when I'll hand out the floor now to someone from Defy Hate Cameroon or from Rogue Agency that will point this out, that is being done is to actively participate in flagging false information, because as a community, it's a kind of duty that has been imposed on us by this new technology, that we also become citizens of the cyberspace and be able to actively flag information that we suspect to be false. And even before Facebook puts in place any new mechanisms, they already have mechanisms, not only Facebook, but all of the other social media organizations. Now, is there any question from the floor? If not, I'm going to ask our panelists to say a few things, and then I'll invite Alphonse. Alphonse, you can unmute your mic and ask your question.
All right, are you getting me now? Hello?
Yes, Alphonse, we're expecting your question.
Thank you very much. It's been a very enriching exercise. I want to find out the issue of stigma. I want to think that it remains highly underreported. And but it is still a big problem within the narrative of the crisis, this health crisis in Cameroon. What does the public need to know about stigma? I think I'm directing this to Charles.
Yes, Alphonse, thank you for that question. And that's something that we covered last week in our bulletin that I was sharing. And I think the number one thing is you can reduce stigmatization by knowing the facts. Anyone can get COVID-19. That is the number one thing, that anybody can get it, no matter if you're in Cameroon or if you're in the state of North Carolina or if you're in China. And I know that there's been, even in the United States or here in the United States, there's been attempts by some of our leadership to call it the Chinese virus or the Wuhan virus, and that is completely wrong. That stigmatizes a certain a group of people, and I think what we need to do is stick with the facts. And as a journalist, we need to tell people how to avoid it, what to do if you get it, and remind everybody that anyone can get it, and it just happened to show up in China first. I think that's the number one thing. This could have happened anywhere. There's wet markets in the United States, so we just have to be really careful. And as Paul Joel was mentioning, we have to stick with the facts. And I think if we stick with the facts, it will reduce stigmatization.
Absolutely, absolutely. I do recognize that there are a lot of interesting questions that people have in your mind. This is just a beginning. I think we're going to continue having this engagement, especially on Twitter. But I really want us to end this on time because people have carved out time to be here with us. So I'm going to, at this point, ask in 1 minute to say, share a few last thoughts. Let me start from Charles. I'll just start as my see you on my screen. Charles, please, a few last thoughts, especially in the form of lessons and what we can do to make this better.
All right, and again, thanks for the opportunity, Eugene. One thing that we have found that is very helpful in Malawi is to be able to engage the public on this. There's a lot of fear, there's a lot of anxiety, and I think what needs to happen is engagement with your listeners or your subscribers or your viewers. And I know that we have set up call-in programs where there is an expert on the at the other end, and whether it's a professor or whether it's a doctor, and let listeners be able to call in, because a lot of listeners have the same issues and they want to bring up the same questions. And I think that's really, really important to constantly engage the audience, because there's lots of misinformation. There's a lot of myths out there, and we can set those aside, especially with radio, because we can reach a wide audience all at the same time and can quickly dispel a myth.
Thanks indeed. Prof?
Well, I think it's been wonderful, and I think I still get an additional medicine is working. Why shouldn't we take it? I think that, you know, by all means, if you desire to take the traditional medicine, take it, but under the caution that it shouldn't cause you any further harm. Currently, I think it's a combination of both Western-style medicine and herbal teas that they're using at the central hospital to relieve the suffering from people. My choice of words are very precise. I said to alleviate the suffering of people. And until we can prove that these have killing effects directly on the virus in vitro, we would say that they alleviate suffering and take away the symptoms, and your body is killing the body also to address this. But I just before I close, I want to touch on something which Charles just mentioned, that this virus is real. It might have started anywhere, and we should take it that it is here, and we should deal with it and deal with the facts as the facts are presented. Having said that, I think the world on exactly the mechanisms by which this is causing us suffering, we would dish this out to the traditional doctors to look for those herbal medications that can alleviate these different symptoms and things that we feel. And then maybe when they come together, we're going to see exactly what they offer. But we should make this balance between beneficence and non-maleficence. Thank you, and it was a pleasure. I'll continue to be open for whoever wishes to ask questions. I think you can share the contact details.
Thanks indeed, Prof. Understanding how taken you usually are, we really appreciate you. Paul Joel?
Simplement pour dire qu'en réalité, il faut faire beaucoup attention parce que il y a trop de fausses nouvelles qui circulent et parfois ces nouvelles-là sont alimentées par les journalistes eux-mêmes. Il faut faire beaucoup attention au partage. Faites très attention lorsqu'on tombe sur un contenu sur Internet, dans les groupes WhatsApp, sur Facebook, sur Twitter, ou même sur LinkedIn. Ça, il ne faudrait pas faire attention. Il faudrait toujours faire appel à vos notions de vigilance, c'est-à-dire la première réaction, c'est le recul, c'est l'analyse des outils calligraphiques du document, parce qu'en réalité, il faut faire très attention. Quand on parle d'outils calligraphiques, c'est le document, c'est le cachet, c'est la signature, c'est l'entête, c'est le contenu qu'il faut analyser. Ça, ce sont des premières analyses du professionnel. Avant maintenant de recourir aux outils, quand il faut approfondir, par exemple, pour rechercher les métadonnées. Métadonnées, c'est-à-dire la première fois que ça a apparu, c'est dans la base de données de Google, c'est dans la base de données de Facebook. Tinaï, par exemple, avec Google, qui vous permet de voir le nombre, les récurrences d'utilisation. Souvenez-vous, lorsque la fausse nouvelle avait circulé qu'une baleine avait échoué au large de Limbé, on a dû fact-checker cela avec des outils comme Tinaï qui nous ont permis de savoir en fait que cette baleine avait été avait échoué au large du Nigeria, je crois que ça devait être dans le sud-est du Nigeria. Et puis, on a eu plusieurs outils, le nombre de joueurs qui ont utilisé cette image pour alimenter leurs colonnes, les journaux papier sur Internet et consorts. Donc, il faudrait beaucoup faire attention, surtout cultiver son carnet d'adresses pour des sources, parce qu'au-delà des outils, il faut approfondir. Le tout n'est pas de dire que l'information est vraie ou fausse, mais le tout est de démontrer techniquement et professionnellement comment la démarche, vous l'avez engagée avec les outils, les sources qui ont été contactées et consorts. C'est pour ça que le fact-checking ne s'accommode pas des scoops, parce qu'il faut prendre tout son temps pour vérifier l'information et non courir après le scoop.
Thank you very much. I did mention at the start that there were two people in the panel who were not going to say something at the beginning, but at the end. I'd like to invite Desmond. Desmond is the country manager of Defy Hate, an initiative of Rogue Agency, which is based in Germany. Desmond, can you say a few words, especially looking at the way forward with this initiative?
Good morning, Eugene. Good morning, panelists. Hello, Charles. Hello, Prof. Hello, Paul. It's a wonderful initiative. Thank you, Eugene, for bringing this community together. We are Defy Hate Now. We are an initiative of the Rogue Agency for open cultures and critical thinking, based in Berlin, in Germany. We've been in Cameroon since last year, and it's our pleasure to work on the sidelines of our principal mission, which is fighting hate speech in Cameroon, but believing that we could build peace much more sustainably through giving concrete and verified information to the community. I see journalists here, I see other people from different walks of life asking questions that are very, very important to realizing these goals. And if I were to say a few words as we're closing, there are two things. One would be what we've done in this area. We've done flagging. We call on all journalists, all fact checkers to, one, do flagging. Information you see and you know, based on facts, not that you flag because your sentiments don't like them, but based on facts that is not true, you should flag them. I think different social media platforms have created community standards in which you can flag them on daily basis, and they'll give you feedback. The second thing we should look at as far as misinformation, fake news is concerned, is making sure that as journalists at our different press organs, we should create fact-checking platforms. We see journalists who somebody stands and say, hey, I am a journalist and I am an investigative journalist. But it becomes interesting when you want to go detail, and Paul would bear with me here, that at times it does not move to the facts. Prof just gave us some very cool facts on the COVID-19, and as it is said, it could have started anywhere in the world. It's not because it started in China. I witnessed a situation in the central market in Yaoundé, where public discussion was like, hey, those are the guys who brought COVID into this country. And to us, we look at this as as a misinformation, but also we look at this from the perspective of hate speech. This is derogatory, this is prejudice against these persons who did not do anything for this virus to start in their own country. So hate speech as well as misinformation and COVID now has got a correlation in which we're looking at that so much closely. We are happy that we're in Cameroon and we've met this big community of journalists and other people such as our partners UNESCO that are well represented here. I think maybe Eugene would give them a chance to say a word, as he earlier mentioned. But this is just to tell us we have way more work to do than what has already been done. I have seen too, those who've signed up, people who have been doing fact checking on their private accounts or private blogs, which is a very good thing. And I think Prof has said it. The contacts are open, and Eugene has just brought a very brilliant idea to go beyond this webinar and make sure that in the coming days, we keep exchanging on Twitter and Facebook and on WhatsApp to see if is this information right, is this not right. So thank you, Eugene. It was a pleasure being here.
Hughes is here. Thank you very much, Desmond. Hughes is here. Hughes indeed works with UNESCO, with the communication team at UNESCO. And UNESCO has been doing quite some work around combating misinformation and also delivering capacities to journalists generally. Hughes, would you want to say a few words? Apparently not. All right. Thank you very much, everyone. Thank you indeed it's been a very wonderful conversation. I really want to acknowledge everyone, especially the participants, with the challenges that we have regarding access to energy. Most parts of Cameroon have been in blackouts. Internet has been very unstable. Yesterday, we were worried that we may not be able to have everyone, but I have been looking at the charts, and at some point, we were nearly 50 of us in this conversation. That was good enough for us. Some have told me inbox they've had to leave to attend to other issues. It's understandable. We're trying to keep these webinars to 1 hour. We've managed to keep this one under around 1.5 hours. That's a good start. I hope that we'll do better the next time. A few announcements. We're going to send out a form for you, especially for the participants, provide us with some feedback on the quality of the work we have done this morning to enable us make the next webinars better. But we are also going to communicate to you some other issues that we have in the pipeline going forward, especially in terms of building a community of people who are actively involved in combating misinformation on COVID-19. Our understanding is that the skills and tools that we learn in this process will be useful in any other sector. So you really don't have to be very interested in COVID-19. But if you're really interested in having access to accurate information, you're very welcome to join us. I'm going to end the meeting here and say thank you very much, and may you enjoy the rest of your day. Bye.
Thank you, Eugene.
Cheers.
Thank you.
Thank you.